Today with us, we have my friend, Dr. Karen Davis. She is the pediatric hospitalist here at St. Joseph Health System, the pediatrics department chair, and the medical director for pediatrics and newborn nursery. Thank you so much for being here today.
Well, thank you for having me.
So, we'd like to let the St. Joe colleagues get an opportunity to hear your story and get to know you a little bit. And so, I'm going to start off by asking you a few questions, if you don't mind.
Sure.
What led you to healthcare?
Well, so my first experience in the healthcare system was as a patient in fourth grade. And I was very fascinated with the environment and the things that were happening. As I went through school, I loved science, and it just was a natural path for me. I also very much enjoy puzzles. And to me, medicine is just a big puzzle to be figured out. And so my love of science and puzzles combined and led me down this path. And the greatest bonus is that I feel like I'm helping people live their healthiest lives.
Thank you for sharing that. So, how could increasing Black clinical representation help address some of the obstacles and disparities patients currently experience?
So I believe that patients relate better to physicians who look like them, who have had similar life experiences as they have. So, being a Black physician, I think it puts me in a unique position to understand um, the obstacles patients face, and as a result, I think I can help them navigate those obstacles as well. Um, I think recently with COVID and some of the vaccine hesitancy, I made it a point to communicate with my family and friends about my vaccination status, which actually resulted in people asking me questions and deciding to actually get the vaccine when they were not sure they wanted to initially.
Thank you for being a soundboard for those people and being able to share information with them. Do you see representation improving?
So I I do. I do think there is improvement. I will give you one a great example that relates to our system. So I work with the family medicine program here. So I have residents who work with me on pediatrics. And prior to 2018, I had only worked with one other Black resident, and that's our wonderful Dr. Jordan. Um, but since that time, when I started in 2013 to 2018, he was the only one. 2018, we saw um, two African American females come into our residency. And then each year since, we've had two additional um, African American female residents. So I have seen a huge improvement with diversity in our family medicine residency program, which I think is awesome.
That is great. Thank you for sharing that information. That's new information for me as well. Do you have any advice for aspiring Black clinicians?
So I do. I think my biggest advice is perseverance. So I think it's important that young Black clinicians take opportunities to sit at the table when they're invited, especially at the tables where decisions are being made. Um, Sometimes it can feel overwhelming, especially if you're one of a handful, because you may feel like you're always being asked to participate. Um, but I think it's important, especially now that diversity and inclusion has come to the forefront. We need to be a part of that push. And so we do owe it to the future Black physicians to continue to keep that path open for more of us to be part of the healthcare system.